Kia ora tātou. Kua hui hui mai nei I tēnei rā, he kai mahi aho mai I Waipapa Mataora. Ke roto aho I te Auckland Bioengineering Institute, ko Diana Siu toko ingoa. No reira, kia ora. So translating what I just said, hi everyone who are here today. I'm from the University of Auckland and I work at the Auckland Bioengineering Institute, and my name is Diana Siu. So welcome to our Otago Town Hall meeting to introduce Tītoki Mataora, Medtech Research Translator to the community. This is a new national initiative in Medtech Research Translation hosted by the University of Auckland at the Auckland Bioengineering Institute on behalf of the CMDT partnership. Hang on. Tītoki Mataora. So basically, I'm one of the co-leads of this program, together with Denise Taylor from AUT, Jeff Chase from University of Canterbury, and Peter Hunter and Peter Thorne, who are both from University of Auckland. And for this talk today, I'm joined by your very own Kun Lim and also Sharon Olsen from AUT. Both Kun and Sharon are part of our executive team. And we also have Tim Woodfield, who's on the other part of our executive team, and he'll also be saying a few words. Now, I would also like to acknowledge the rest of our team who are dispersed somewhere on the Zoom screens. Tītoki Mataora is an initiative of the CMDT, a partnership of AUT, Universities of Auckland, Canterbury and Otago, Victoria University of Wellington, and Callaghan Innovation. Ara Manawa and I3, the innovation arms of Auckland and Waitemata DHB, have just recently joined this partnership as well. And it's really nice to see, and actually really cool to see you here, David Grimmett, who is part of the CMDT leadership team. Now, the CMDT is New Zealand's research industry network and was founded in 2012. And since then, we have led several major initiatives for the MedTech ecosystem. So I would like to take the opportunity here to acknowledge one of these initiatives, which is the Medtech Center of Research Excellence. And some of you will know that really well as the Medtech Core. And also I'd like to acknowledge Marin Tafai, who was our director for the last 3 years, and Richard Blakey, who is here somewhere amongst us and who was part of the Medtech Core board. The core ended this year, but it is very much part of the DNA of Tītoki Mataora. And I would also like to take this opportunity to acknowledge that one of the purposes of Tītoki Mataora is to advance the relationship that was developed between Brain New Zealand and Medtech Cores in the last 6 years. And so, hi Cliff, it's really good to see you here too. So before we launch further into this talk, I just want to emphasize that in our context, when I talk about MedTech, it really refers to devices and digital health technology applications. And this is, includes machine learning and AI, as well as applications in health literacy. So Tītoki Mataora was developed to take public funded research and turn this into technologies which will help provide better healthcare for patients and grow New Zealand's MedTech sector. This is now a sector that's worth greater than $2 billion for New Zealand. We all know that it's dominated by Fisher & Paykel Healthcare, but there is still a strong pipeline of established companies today that spread across the nation. And some of the examples are Aotearoa Biomedical in Auckland, Volpara in Wellington, Arends Medical in Christchurch, and Pacific Edge in Dunedin. So Tītoki Mataora advances and extends the successful translational program that was piloted through the Medtech Core and developed over the last 6 years. This program spun out 18 deep tech MedTech companies, of which 12 are still active and growing. These 12 have collectively added 85 new high-value jobs into the economy, and just as of last week, valued at 83 million. Now, 3 of these companies are the Insights Company, Formus Labs, and Alimetry, which I've shown here. These companies are globally competitive, and in New Zealand, recognized as game changers in their fields. So what we're seeking to do in Tītoki Mataora is to create more such companies for us. The program itself supports research groups to develop medical devices and digital health technologies that are sustainable so that what is developed can reach the public and make an impact from actually 3 points: health, social, and economic perspectives. And what I'd like to just point out is that when I talk about sustainability, I mean you can actually want to build the next Fisher and Paykel healthcare, or you might want to build a nonprofit. But whatever it is, it needs to be economically sustainable so that the technology can be cared for and available. So the name of Tītoki Mataora was gifted by the Turowhenua whānau, and our connection with them is through Jason Turowhenua, who is the Associate Director Māori at Auckland Bioengineering Institute. And this name is really quite interesting. So we asked the Turowhenua family to actually find us a name that will represent not just the research and the health perspectives, but also how we knit together Medtech and the Brain New Zealand relationships. So this is what they've come up with. Mataora actually refers to the wedges that are used in the waka, and it's technology that, you know, it might not sound interesting, but it is actually really critical to holding the waka together. And Tītoki refers to a New Zealand native tree with health-giving properties. And it conveys the ideas of strength and healing. So Tītoki Mataora brings together the concepts of health and technology to restore well-being. And it's really a really cool descriptor of what we're trying to do today. So these are the 5 objectives of our program. It's to build effective research translation capability and a pipeline of new deep tech companies for New Zealand. We want to look at fulfilling Te Tiriti requirements by addressing inequities in health and well-being experienced by Māori through partnership, co-development of technologies, and new opportunities in research, training, and business. We want to help develop a skilled and diverse workforce, not workshop, to help accelerate industry growth. And we want to consolidate and better connect the national medtech ecosystem across Auckland, Wellington, Christchurch, and Dunedin. And this is the backbone of the CNDT. And finally, we actually want to make New Zealand a place that people want to come and play and stay as well. So Tītoki Mataora is co-funded by MBIE and the University of Auckland to a total of about 10 million over 3 years. It is made up of the 2 intertwined programs as shown here. So the first part, which is a research acceleration program, is a contestable fund to support early stage concepts and accelerate clinical uptake and commercialization. And this is the part of the program that is funded by MBIE on for the CFDT partnership. The HealthTech Capability Programme helps to develop new knowledge and expertise in bench to bedside applications. And it also provides new opportunities for students and our early and mid-career researchers and clinicians to grow in their careers. The HealthTech Capability Programme is funded by the University of Auckland with in-kind contributions from our university partners. Tītoki Mataora, as I mentioned before, also brings together the Medtech Research in Aotearoa Brain Network, curated through the Medtech and Brain New Zealand course to create new opportunities for New Zealand in neurotechnologies, and also to achieve greater capacity for New Zealand in Medtech translation. And there is actually an even bigger picture ultimately. Tītoki Mataora is not a standalone initiative. It is one of the pieces of the jigsaw that will contribute to a national Medtech innovation hub that is being developed called Medtech IQ. This is currently in planning stages. And what Medtech IQ will do eventually is to help pull together the activities in New Zealand Medtech innovation and make this visible globally. So in the next part of our talk, we'll dive deeper into the two parts of Tītoki Mataora. And now I'll hand over to Kun, who will take over.
Thanks, Sai. Thanks for that introduction. Thanks for showing where the Medtech Tītoki Mataora is fitting in the bigger picture. So if we look more into just the context of the research acceleration program that I have touched upon and where it sits in the ecosystem, what we have identified here is there currently is a gap in the system at the very early stage of commercialization towards at the Medtech innovation pipeline to help kickstart and nurture some of the ideas and hopefully to curate this concept with potential that actually fits currently in the ecosystem. So the REP was developed to really fit the proof of principle stage and to help research groups to sort of check out their translation ideas and then provide a little bit of resources to help explore these ideas. And to explore if these ideas if there really is a clinical potential in the idea, or if the idea can be economically sustainable in the long run, either as a billion-dollar industry or as a non-profit organization. So what we hope the REP can do is to really help de-risk these projects for further development and investment by answering some of these questions, and the projects that come through the program hopefully would have a higher chance of success as they move towards this innovation pathway. So we see the REP being a pipeline of opportunities for pre-seed accelerator fund investments and other angel groups in the first instance. So there are a couple of different stages of funding as part of the REP as indicated here, and we will go through each of the different stages, so 1, 2, 3 later more in detail in the next couple of slides. But there are some key guiding principles that are associated with this funding. So REP funding is available for researchers from universities and research institutes, as well as clinicians and allied healthcare providers. Proposals for both stage 1 and 2 must be a collaboration between at least 2 organizations, with one being from a CMDT partner, can be AUT, University of Auckland, Canterbury, Otago, Victoria, University of Wellington, Callaghan Innovation, and I think there's 2 other institutions that have joined recently, as I listed earlier. And the projects must bring together research, clinical users or partners, and technology transfer expertise. And we believe, this team with all of these different expertise will form the foundation of successful medtech ventures. So commercial links to companies are strongly encouraged, but it's not a must-have in the proposal, and the companies can be collaborators in the project. But bear in mind that the funding does not cover their participation unless they are delivering a specific service to the project. And it's also important to mention that all IP generated will belong to the research team and their institutes. So diving deeper into the stage 1 funding, which is the collaboration and ideation part of REP. And this part of this program was designed based on feedback from researchers where there is a need for travel support to develop new relationships, especially when your new collaborators are in different parts of the country. So it can be used to form new relationships between researchers, clinicians, companies, and also with our Maori and Pacifica communities, and also to support workshops if there are many of these different groups that are involved. So we see stage 1 funding supporting the ideation activities and also can be assessed by existing collaborations that are developing new concepts that they have not worked on together before. Projects between 10 to 20,000 are sought, and there is an annual pool of 140,000 that is set aside for stage 1 projects. And there is an open request for proposals with awards announced every 2 months. And I think it's currently open for any applications, and submissions can be made. So more information will be on the website as well. So for stage 2, funding is more for concept seeding, and is to help identify ideas with the potential of becoming viable clinical applications and also commercial opportunities. And the emphasis is really on translational research and projects that are expected to build on proven basic research and take the idea to early stage prototypes for proof of concept, particularly from a clinical perspective. So projects are between 40 to 80,000 with a typical completion of about 12 months from the starting date. And at the moment, we've put aside 1.2 million for stage 2, and we expect to fund somewhere between 15 to 20 seed projects of mixed sizes. So there will be 2 calls for proposals a year, and we have already opened the first call for request for proposal, and I think it's due in March. And I'll show a timeline as well in the next couple of slides. So stage 3 is where we see acceleration of these projects that have come through the program, and it's to help fund project teams to refine their technologies. Once the proof of concept is already established, it can be used to support next stage of the prototypes, small scale trials, preparation for commercial readiness. And at the moment, applications are by invitation only, and we are looking to support projects that would have come through the stage 2 concept seeding process that has been completed successfully. So we are looking at about 6 projects of 100,000 annually put aside for stage 3, and that will be about 600,000 in total for stage 3. The fund will run twice a year, following a similar timeline for the stage 2 funding. So for early next year, in the first year of funding, we currently are looking at projects that were previously supported via the Medtech Core contestable process to provide some continuity for those teams. But we will, from time to time, put out expressions of interest for projects that have come from other sources of funding. So please register your interest for the Acceleration Fund on the website. If you are a part of the CMDT partner organization, and for Otago, people at Otago are more than happy to chat about the opportunities for the REP program. And please get in touch with either myself or also Tim Woodfield, who will give a couple of words as well later at the end of this talk. So this is the funding timeline that is already published on our website. So please have a look if you can. So stage 1 projects again can be submitted anytime. It will be assessed every 2 months when we meet, and funding will be awarded within 2 to 3 weeks of the proposal's due date. And then we have stage 2 and 3 funding that the request for proposals will open twice a year. So and it will be due in March and August for next year, and funding will be awarded 4 to 8 weeks after the proposal's due date. So these are the people on this slide here are representatives on the REP program's exec team from all of the different CMDT university partners. So for University of Auckland, it's represented by Peter Hunter, Jason Turuf-Noah, Natalie Solomona, and also Dai, who has done our introduction today. For AUT, we have Denise Taylor, and we also have Sharon Olsen, who is also giving a talk later on the HealthTech Capability Platform. On this call today as well. For Victoria University of Wellington, that's Simon Fraser. Canterbury, University of Canterbury, that's Jeff Chase, and myself at the moment, I'm representing Union of Otago. Our operations team are led by the very talented Natalie Solomona and Kate Omerod, who always keeps us in charge and also make sure we're very organized. So more than happy to answer questions that you have about the REP program. And I think this is a good time to also show you the governance structure of Tītoki Mataora in general, where we do have an independent oversight board, which both the REP and the HealthTech Capability Programs report into. The board has a good representation of industry, government, and academic leaders in medical devices and digital health technologies. And even within the REP, we also have an independent scientific, clinical, and industry advisory group that excludes all CMDT university partner organizations that help lead funding decisions for both stages 2 and 3 of the contestable process. So both the board and advisory group members are currently being appointed, and we will be announcing them in the new year and also on the website. So with that, I will pass it on to my fellow rep exec team member, Sharon, to walk you guys through the HealthTech Capability Programme.
Thanks, Con. Kia ora, everyone. Just to reorientate you, so Con has gone through the RAP program, so that's one part of Tītoki Mataora, and I'm taking you through the second part, which is the HealthTech Capability Programme. So some of you may have heard of this program through the Aotearoa Brain Network, so it may be familiar to you already. So we'll take you through this. So this program, should we go to the next slide, Di? Yeah, excellent. So this program includes 6 modules. And the first 5 of these modules were actually identified by the Medtech core and the Brain Research New Zealand core in their previous rebid process. So those ideas were taken forward and established within this new program to meet the needs of both of those groups that had actually missed out on funding. So this is a really exciting program, and you'll see it's a really nice collaboration between the new Medtech and Aotearoa Brain Network. So whilst the HealthTech Capability Programme has its own exec team to oversee the program, you'll see that each module is led by various researchers. So they've got leaders and people working within each module to set its objectives and to ensure that there are activities working towards those objectives. Everyone is welcome to participate in these modules, and so if you're interested in any particular ones, do make sure you go to the website and sign up for information. So we'll just go to the next slide, and I'm just going to talk through each of these a bit more specifically. So the first one, Mātauranga Māori, is a module that's led by Macarena Dudley and Jason Turawhenua, both from the University of Auckland. So the vision of this module is really to ensure that Māori are creators and navigators in the development of the next generation of health technology, and to ensure that we're building a research community that's really confident and equipped to engage with Māori. There's a really a strong emphasis as well on ensuring that we're building Māori capability within our research teams. This module is currently piloting a summer student program, and they're also going to be embarking on a landscape study to explore potential partners in the Māori community who might be interested in collaborating with health research. There's also a partnering program being developed to facilitate relationships between various research groups and community Māori groups. And then we have the Pacific Engagement module. So this is led by Amio Matenga Ekahele. She's from Moana Research, and Natalie Solomona from the University of Auckland. This module aims to increase engagement between Pacific communities and the New Zealand health tech sector. So there's a few things that they're really focusing on. The first is to increase awareness among Pacific communities about the potential benefits of them being involved in the health tech sector. They also want to really support the cultural responsiveness of people already working in the health tech sector, and ensure that they're meeting the needs of Pacific communities. And then also to facilitate opportunities for research groups to work with Pacifica communities and to work together and potentially co-design new health tech solutions that are going to meet the needs of those communities. And like the Mātauranga Māori module, this module is also piloting its first summer student program at the moment. Then we have the Future Research Leaders module, and I've probably got a little bit of a bias towards this one. This is the one I'm most excited about as an early career researcher myself. So one of my roles on the RAP team is to sort of represent future leaders. So I'm particularly interested in this module. This is really aimed to enhance the capabilities of those sort of early and middle career researchers. So it's led by 4 early and middle career researchers They're all from the University of Auckland. Two of them, so Bridget, Ryan and Helen Murray, are representing more the neuroscience side, so sort of from the brain network side, and then Julia Schwan and Peng Du from the biomedical engineering side. So it's a nice collaboration between both the Medtech and the Aotearoa brain network. So this module aims to establish a wide network of early and middle career researchers that really collaborate with each other and build both across disciplines and across institutions. And also there's a real focus on providing practical training to equip researchers with the skills that they need. If you haven't heard already, there's going to be a launch event in about the middle of February, and that's going to be live streamed across various venues. And then there's also going to be some face-to-face workshops next year in the ABI 20th anniversary week in end of March, and also in the HealthTech week in Auckland in June. They're also hoping to run some cultural competency workshops, and you'll see that whilst each of these modules has its own objectives, there's quite a bit of interlinking between the various modules. So the Māori competency workshops that are hoping to be run through the Future Leaders module have quite a bit of crossover with the Mātauranga Māori module. And then moving on to the clinical translation module. So this is led by Robin Whitaker and John Windsor. And this module supports the development of medical devices and digital health technologies by enabling more efficient ways to undertake early stage clinical trials for verification and validation of those new technologies. So it's really trying to increase the skills and knowledge around conducting those early clinical trials. It's also hoping to provide a greater connectivity between the researchers and clinicians as well as industry. So there's two initiatives within this module that are underway at the moment. The team are currently pulling together an expert advisory group of clinicians and other sort of subject matter experts, and they're hoping to enable them to be able to provide advice on a range of topics that are relevant to early stage trials. And they're also developing a clinical health tech research network. So potentially if there are clinicians out there that are really interested in collaborating on new research ideas and health tech projects, please do get in touch with Robin and John about how you can be involved. And onto the fifth module, which is the Medtech translation module. So this is run by 4 researchers, so Sav Taharian in the ADHB, and then from the University of Auckland, Sam Richardson, Ella Dixon and Dinah Sue. And this module really aims to help with the commercialisation process. So it's going to help provide resources and programs to help researchers navigate the early stages of commercialisation. There's 2 initiatives. So firstly, there's an exciting pilot, which is hoping to bridge both researchers and business students. So the idea of this is that there's postgraduate business students that are keen to apply their skills and gain some experience, and so there's going to be a process where research groups can actually access those business interns and try and get some help with the expertise they need to really start those early stage business plans. So the idea of that is that the internships will be run a bit like a consultancy service, where the interns are rotated through various research groups that are looking for help with sort of early market validation and business plans. And actually there's 2 interns that are currently being employed, so they will be available shortly. And the second initiative is one you may have heard of, the Australia-New Zealand BioBridge. So this is an initiative to help connect the health tech innovation ecosystem between New Zealand and Australia. And this facilitates curated workshops for groups in New Zealand or Australia who are seeking collaborators, and that might be academic, clinical, or industry collaborators. And as well as the workshops, it also facilitates one-on-one introductions with experts as well. You might have heard of the Liverpool Innovation Project, so that project is really underpinning this idea. So that project includes 11 organisations, which includes the Liverpool Hospital, Ingham Institute for Applied Medical Research, the University of Sydney, Western Sydney and Wollongong. So there's an exciting project there that's sort of linked in with this. So if you're interested in any of those things, please do get in touch with Di, who's involved in that module, and she can have a chat with you about it. And last but not least, the most important one, the operations module, which is mainly responsible for communications, but also organising the Medtech annual conference. This is largely run by Natalie, Solomina, Kate Omerod and Ella Dixon, and with help from Di and Peter Thorne. And so they're hoping to arrange a conference for middle of next year in June in Auckland, and that will coincide with the HealthTech Week. So lots of information on that slide about the 6 different modules. Hopefully that made sense. I'll just show you the exec team for the HealthTech Capability Programme. So you'll see that this team is co-led by Peter Thorne and Diana Sue, and you can look there and see that your Otago rep there is Tim Woodfield, who's going to finish up shortly. Yeah, we might go to the next slide. Yeah, great. So we've covered quite a bit in this time. There's a lot of information that we've gone through, but the intention was to give you a bit of an overview and to also let you know that we're going to follow up with some smaller group meetings across Auckland, Wellington, Christchurch and Dunedin early next year. So yeah, it's a really exciting program. We hope that you're going to join with us and get behind the new initiative. And yeah, we look forward to hearing from you in the future. And I think I'm going to hand over to Tim. Do you want to share your screen, Tim? And just to finish up.
Sure, will do. Okay. Well, thanks everyone. It's great to see everyone join and attend. So what I wanted to try and do is, you might be thinking, well, what do we already do within Otago that already links with this initiative? What sort of machinery do we actually have within Otago to also support some of these types of initiatives? So we have the Centre for Bioengineering and Nanomedicine at Otago, and it's been involved, I guess, for quite some time in the medtech space. So it was established in 2009. So we had our 10-year anniversary a couple of years ago in 2019, and the vision of the Centre for Bioengineering and Nanomedicine is around being a thought leader around management of interfaces between science, medical research, and industry. And so I think you can see is that it's been established as kind of the interface at the university for trying to interact with a number of different centres of research excellence as a way to collate diverse or multidisciplinary researchers across the university and specifically across all the 3 campuses. So I hope you can see there's quite a nice sort of interlock between some of the different types of initiatives. A number of you here or joining have been part of either the previous MedTech core or also the brain core, and so under the umbrella of bioengineering at Otago, we have, like I say, this is sort of part of a machinery or a way that we can collaborate, but also share information. And this is a really nice way that the university can help integrate into these types of initiatives within Tītoki Mataora. So like I say again, essentially it's a way to try and support all the different multidisciplinary research that goes that occurs across the whole university. So like I say, specifically Dunedin, Christchurch and Wellington campuses. That actually places you in a really fantastic position for these types of initiatives, you know, with Tītoki Mataora, because it means we can collaborate widely across a number of different institutions across all these different campuses, you know, then obviously with the University of Canterbury or Victoria University of Wellington or any of the DHBs, along with then all the other partners, the University of Auckland, AUT and all the rest. So, so just briefly, there's a couple of key themes that I guess that drive the Centre for Bioengineering and Nanomedicine as it currently stands. Some of these focus areas are in biomaterials, another area regenerative medicine, imaging, and then a very, very broad area in terms of point of care and information technology, which covers also telehealth, e-health and other aspects like this. So they're very, very broad, but I think the main message is that it's a very inclusive group. So it doesn't feel that if you're not focusing, if basically you're got anything to do with medtech or also health tech, from both basic research all the way through to looking at clinical or commercial translation, then we're very keen for everyone to be involved. Part of what we try and support, not directly within the centre, but that there's also postgraduate research and other opportunities in terms of also masters and PhD programs, which the centre tries to support. So if you want to know a little bit more, just jump on the website. A number of you will be familiar with some of the work that's going on, and also what happens at the within the Centre for Bioengineering at Otago from both previous medtech or brain cores. But there are potentially a large number of fresh faces here today, which I think is really fantastic. So one thing I thought we would do is we did a very short 2-minute video, which just gives a summary of what's happening across some of the different types of campuses. And so I thought for all of those attending today, we could try and play that. So if hopefully you'll hear the sound when this plays, but hopefully you'll just see a quick 2-minute video which tries to show some of the different technologies and research that's going on across the campuses.
Where biology meets engineering. Where human meets machine. Where the predictable meets the unpredictable. This is bioengineering, an exciting and advanced field that sits at the intersection of technology, engineering and medicine, where solutions can improve health outcomes for millions. Join world-class scientists at the University of Otago, New Zealand's top university for academic performance. The Centre for Bioengineering and Nanomedicine brings together our award-winning medical science program with the brightest minds in technology and engineering. Our unique point of difference is our ability to connect you directly to clinicians and patients across our Dunedin, Christchurch and Wellington campuses. Today's biggest challenges need multidisciplinary solutions. We work across many spectrums of knowledge to deliver breakthroughs in imaging, biomaterials, regenerative medicine, and point-of-care technologies. Our researchers are looking into the body like never before. We help cells regenerate and 3D print replacement bones and cartilage. We develop diagnostic technologies and connect remote African villages to vital testing. Join us and put your knowledge to work in ways that can make a difference to people all around the world.
So I'll stop there. Like I say, it's more of a promotional type video, but I wanted to give a snapshot of a number of different multidisciplinary projects that are in there, and yeah, opportunities for linking under the centre, but also via this this program, particularly for the capability building aspects of the program. But yeah, also just to make sure that you are aware and really take advantage and have a look at the RAP program and some of those stage 1, 2 and 3 funding. Yeah, because it's all geared up for some really nice national collaborations. So it's very exciting. So thanks again.
Thank you, Tim.